I told you there was a simple way to prevent your children from getting deadly diseases, and it was 98% effective, would you do it? Too good to be true? No, it's available in every pediatrician's office. Today I will be persuading you to provide your children with the necessary vaccinations to protect both them and other children. Why does this matter to me? I don't have any kids. Well, in 2014, my goddaughter was diagnosed with a rare blood disease that leaves her immunocompromised, and the lack of vaccination in the United States puts her at risk for severe illnesses. Vaccination has built up immunity in the United States for decades, and the only way to continue prevention of deadly illnesses is to provide children with the necessary vaccinations to protect them and all other people they come in contact with. First, let's take a look at vaccinations' effects over the years. All of the immunity vaccinations have spent years and years building up in the United States is said to be at risk due to the decrease in people vaccinating their children. By the year 2000, measles in the United States was almost non-existent due to vaccinations, but just 5 years later, a measles outbreak was traced back to an unvaccinated United States resident. The only thing preventing a national outbreak was that there were enough people in the community vaccinated against measles. This is known as herd immunity. The National Institute of Health defines herd immunity as when the community is immunized against a contagious disease, most other members are protected from infection because there's little opportunity for the disease to spread. Data shows that herd immunity works, but only if most individuals in the community are keeping up with their vaccinations. Although many of these diseases have been completely wiped out in the United States, the increase of foreign travel allows for these diseases to come back into the United States, and a lack of immunization along with the increased foreign travel I mentioned could allow for these diseases to spread quickly. This is why the common misconception that vaccinations are no longer needed is false. Still today, thousands of United States citizens acquire some sort of serious illness that could have been prevented with proper vaccinations. There's an easy solution to this problem. Provide your children with all of the necessary and encouraged vaccinations, and consider the optional ones as well. Many people don't even know what these diseases are or how they would affect their children because there is such a low incidence of them in the United States. Most people don't know what polio, rubella, diphtheria, measles, mumps, rotavirus, and pneumococcal diseases are. The flyers in the pediatrician's office list all of the symptoms and complications vaccinations help to prevent. They can all be summarized in just one sentence. Before vaccinations, many children in the United States became disabled or died from these now preventable diseases. Many children in countries with lower vaccination rates still do. What most people do know is that some vaccines are necessary to start their children in school. In Ohio, the vaccines to help prevent diphtheria, tetanus, pertussis, polio, measles, mumps, rubella, hepatitis B, and varicella or chickenpox are all required for children to enter kindergarten. They're necessary because this is the first time that many of these children will be exposed to other people and come in contact with them, and there are people that are not their family members. Some parents are now turning down these vaccinations, as well as other highly encouraged and optional ones, putting their children and the children in their classes at risk for contracting these terrible diseases. And you might be wondering what professionals think. Vaccinations are encouraged by almost all medical professionals. The American Academy of Pediatrics believes that every child in the United States deserves immunizations and the safety that they provide. Pediatricians strongly recommend that people get their children timely vaccinations because delayed vaccinations can also put their children at an increased risk. So how exactly do vaccinations help solve this? Vaccinations easily reduce the risk of acquiring serious diseases, the complications from these diseases, and they reduce the of you transmitting them to other people, especially those who are unable to be vaccinated. Although vaccines don't come with a 100% guarantee, most childhood vaccines are 85 to 95% effective. For example, since the Haemophilus influenzae type B vaccine, the number of cases decreased from 20,000 to under a few hundred. Immunizations alongside proper sanitation and nutrition are the most effective way to save lives and to prevent the spread of disease. Some people cannot receive vaccines, so vaccinating your children is helpful to prevent diseases in these individuals too. People that are newborns, pregnant women, and others that are immunocompromised may not be able to get some vaccines. Being around vaccinated individuals provides them with some protection due to the inability of a contagious disease from spreading. Hopefully you've realized how important vaccination is and how it can help save your children and others from terrible diseases. So we have some steps to help you get started. First, contact your primary healthcare provider to receive a list of your past immunizations. Then begin to consider updating your outdated immunizations and maybe getting some more optional ones as well. Make sure to vaccinate your children following the CDC's child vaccination standards and schedules. Thank you for listening, and I hope that you take action to reduce everyone's risk of acquiring these deadly diseases.